Well, in my clinic experience more recently, more and more patients with restless leg syndrome are reporting that they're taking Kratom to help with symptoms of restless leg syndrome. I'm really concerned about this trend, and I want to warn people not to take Kratom for restless leg syndrome, and this video discusses why. I'm Dr. Andy Burkowski of ReLACS Health. So, what is Kratom? Kratom is an herbal supplement, so to speak, comes from the Mitragyna speciosa species of plant that's native to Southeast Asia and other countries. And it's become increasingly popular, perhaps throughout the world, for conditions like pain, but also for restless legs syndrome. And as I've spoken about elsewhere, restless leg syndrome patients are pretty desperate for treatment, particularly because some of the previous first-line treatments make the condition worse. Many physicians know very little about restless leg syndrome. And then the treatments that we do recommend for restless leg syndrome are not often provided, like iron infusions and opioids. And that's where Kratom comes in. Kratom is actually opioid-like in its properties. So yes, Kratom can reduce symptoms of restless leg syndrome. And it's thought that Kratom is both sort of an opioid medication. It affects the opioid system, but it also is a stimulant. It's both kind of an upper and downer to the brain. And that's where we get into a lot of trouble when it comes to this kind of over-the-counter herbal supplement. Though people taking Kratom in the short run for restless legs may have relief, over time, a lot of problematic events can occur. One being tolerance and dependence. Tolerance is where your body gets acclimated to the drug and you have to take more and more of the drug to produce the same effect. Dependence is where your brain is dependent on the drug, and if you go off the drug, you'll go through withdrawal. I've seen this time and again in a handful of patients who have taken Kratom on a regular basis for restless leg syndrome. There's also increasingly published case reports and case series of this happening to patients taking Kratom recreationally and for other conditions. There are also a lot of mental health effects which are also concerning, perhaps some degree of heightened anxiety, sometimes depression, sometimes some psychotic or experiencing symptoms of them, individuals not being present within their own mind. And this is really where the concern is that some people get caught between a rock and a hard place. They take more Kratom, it starts to have mental health effects. They take less Kratom, they have withdrawal. This is a major problem and a good reason not to get started on Kratom as an alternative to drugs that we've tested and know about, whether good or bad, for the treatment of restless leg syndrome. One of the treatments that is used for restless leg syndrome, buprenorphine, has been shown to help with Kratom dependence and withdrawal as a sort of opioid replacement and a safer, more consistent medication for this. But ultimately, one individual who is, if an individual is dependent on Kratom, should seek the guidance of a licensed medical professional with experience with Kratom. This is usually going to be an addiction medicine physician who has experience with Kratom and or buprenorphine, which might be a common drug to get people off Kratom. So again, as I talk about in each video, this is not specific medical advice. So if you are an individual with restless leg syndrome, it's probably not worth even trying Kratom right now. And if you're unfortunately stuck on Kratom, you do need to find medical help. But there are ways of getting off the medication. I've had success with using buprenorphine to get several patients off Kratom and get their restless leg syndrome under control. And the bottom line is sometimes the natural or herbal remedy is not necessarily better than the big bad prescription drugs. So be careful when it comes to Kratom. As always, this video is for general medical information only. It does not constitute the practice of medicine. All decisions regarding restless legs, medications, and other health conditions should be done under the guidance of a licensed medical professional. And as always, one of the keys to sleeping well is to relax.